Hey everybody, Allie here. I hope that you're having a fantastic day. So one of the things that you really need to know about if you are caring for a senior is urinary tract infections. Why, you might ask? If you've never experienced it, then that's a good question. But if you have, you may be like me. So one of my very first experiences in senior living was that our team member went to go wake up one of my favorite residents, and she would not wake up. She was non-responsive. Her blood pressure was low. She scared us to death, actually. We had to call 911. They took her to the emergency room, got her rehydrated, got her on an antibiotic, and it turned out that a urinary tract infection had caused all of that drama, and we really thought she was dying. So here's the truth when it comes to UTIs and seniors, is that it actually can kill your senior, as sad as that is. And so it's important to understand, first of all, that seniors do have different responses to urinary tract infections than younger people do. So in most people, they're going to complain about pain in their stomach or when they urinate, or there's going to be frequency. They may even have a fever. But with seniors, they might not have any of those symptoms at all. It's possible to have them, but they may have no symptoms other than a change in behavior, attitude, personality, basically acting differently than you've ever seen them act before, maybe even seeing things like being totally just bonkers. And so if you have ever taken someone to the doctor and said they're acting different, that's why they do a UA to find out if there's a urinary tract infection going on, because it does affect seniors that way. So it's important to understand, first of all, that it can happen very, very quickly. So if you see a change in behavior and maybe anxiety levels or just confusion, and it happens really fast, overnight almost, then you could be looking at an infection. So that's why they always check for infections first when we go in and complain about those types of things. So that being said, it can get bad enough to cause sepsis and for a person to lose their life. So it is very important, if you are taking care of a senior and you notice any behavior changes, any bathroom habit changes at all, and any dehydration, that you get to the doctor or call in your home, whoever's taking care of your loved one at home, get that medical care in there and get them taken care of, because we don't want to lose someone over something that is preventable, obviously, and sepsis is a terrible thing. So how to prevent them? A lot of people swear by cranberry juice and probiotics, and while the FDA doesn't approve those things, a lot of people anecdotally say that it works. One thing that definitely does work, the best probably, is staying hydrated. It is really hard to keep seniors hydrated if, like me, you have placed numerous cups of water or little bottles of water beside them only to find them still full later on. It can be frustrating. So remember that there are other ways to stay hydrated. Water's a fantastic option, but when you're a senior, oftentimes your taste buds aren't working properly anymore, and water just tastes yuck. And so what I would recommend is adding some flavor, whether it be Crystal Light or Kool-Aid type thing, whether you add fresh fruit. But definitely, if you have color in your liquid, they are way more likely to respond well and to drink it. Also, don't forget that there is a lot of food out there that can hydrate. So fruit obviously is a fantastic thing if you're not diabetic, to be able to have lots of fruit and vegetables that are rich in water. And of course, there are things like oatmeal that have water in them. Soups, of course, popsicles, Jello, but basically don't give up. Water is hard to get in a senior, but you can do it all kinds of different ways. So don't give up. And if you need any help with your senior, I'm here to help. Hope you're doing great, and take care. Bye.